we can't do this without the media's help. I want to thank everybody who's here today. Let me start off by saying, back in April of 2020, we developed, in a response to the public health crisis caused by the pandemic, we established a local task force, and it's comprised of those who you see with me today. The Trimble County Health District, Frank Migliozzi, Warren City Health Department, John May, who's representing us, as well as Mercy Health. What is your name again?
Dr. Shina with Stewart Healthcare.
Stewart Healthcare, Dr. Shina, okay. And of course, the Chief Clinical Officer of Mercy Health, Dr. Kravix. So I'll have them talk a little bit later. But when we developed this task force at the beginning of this pandemic, obviously the statistics were overwhelming, and we had to make a lot of changes. I will say every Monday, as of April of 2020, we've been conferencing, getting together every single week, and for me that's been vital because I get information. The Director Colbert has convened those meetings and facilitated those meetings, but it's been very important for us in terms of how we set our policy and how we manage our employees and what we're doing from a public health standpoint within the city. So that's been invaluable. Statistically, at the beginning of these conferences, these phone conferences, these meetings, obviously the numbers were staggering. They were overwhelming in terms of the caseload, the infected case rate. We saw a lot of information that really helped us develop some policy, but it also dealt with our congregate care sites, our schools, as well as our hospitals, institutions, nursing homes, et cetera. And they were really overwhelming, and it caused a lot of bottleneck atmosphere in our emergency rooms, the amount of beds used and all of that. Then we shift to some months later, perhaps a year later, and with the introduction of the vaccine, we saw those numbers go down. But the reason I'm having all of you here, and I'll have all of the representatives speak, those numbers are going in the wrong direction right now, particularly among young people and unvaccinated people. So that's why I'm asking for the public's help. I'm asking that they take this seriously. We are in a public health crisis, and we want to keep our kids, if we want to keep our kids in school and enjoy the things that we're starting to enjoy, then we need to take this seriously. I read a quote, and I had it by Dr. Bruce Vanderhoff from the Ohio Department of Health, and I think he said it clearly. If you're unvaccinated, if you're young and unvaccinated, and I'm paraphrasing, it's not a question of when you get COVID or if you're going to get COVID-19. It's a question of if. Or excuse me, it's a question of when. So that goes to say that, and he also quotes that, you know, if you don't have the protection of a vaccine, you'll either end up in the hospital or on the obituary pages. So it's in that spirit that I'm asking for everyone's help, everyone in the public, to take this thing extremely seriously. With that, I'm going to call Dr. Shina first, and you can talk about Stewart Healthcare's experience.
Thanks for having me. You know, I have multiple roles within Stewart Healthcare, and the most important is I'm still a practicing physician. As a matter of fact, I came here straight from Trumbull Regional, where I'm, rounding on these sick people. And again, I agree. I can't express enough the need for the vaccination. We know it's safe and effective. The numbers in the hospitals, the vast majority, upwards of 80% at least, in the hospital are unvaccinated and young individuals. The case percentages, again, have been pretty high. In intensive care in particular, about 100% are unvaccinated, those that require mechanical ventilation and other more aggressive forms of therapies. Again, minimal breakthrough cases that we're seeing in the hospital. So the vaccine, again, has been effective. When I counsel my patients in the office, it's the same thing. It's there's a lot of questions. Unfortunately, the public, has access to kind of whatever information they want, especially on the internet, and hearsay through some other folks. But, being in the middle of this, both on the outpatient side and on the inpatient side, it's very, very real. The young people are getting hit pretty hard. It's extremely important to be vaccinated. Stewart Health in particular, we have, some outpatient testing sites, especially down in Austintown at our urgent care area, and also offering the vaccine to those folks that aren't part of our medical group at the moment at our multi-specialty clinic in Austintown. Again, those are readily available at your local pharmacies and other departments as well. In regards to symptoms, still about the same. Fever, aches, chills, still with the taste and smell loss. Some abdominal issues we've been seeing a lot of. Again, minor issues like that, please call your primary care office. Please get in to see your primary care physician. They can lead you in the right direction. We don't want to overwhelm our emergency rooms with mild type cases, but other symptoms such as chest pain, shortness of breath, real lethargic where you can't wake somebody up, those need to be seen in the emergency room. Emergency rooms and hospitals are safe. The cleaning aspect in those areas are very strict, very stringent. If procedures go on without a hitch, everybody gets tested that needs to go through there. But please use the emergency rooms wisely. I highly advise you to call your primary care physician if you have any issues there. But again, the vaccine is of utmost importance. The people that are the sickest, the ones that are dying, the ones that are close to dying that we're trying to save are the ones that are unvaccinated.
Thank you. Thank you so much. My experience through our conferences is that the data shows that there's a direct correlation that we can see that when the vaccines started to drop off and people stopped getting vaccinated, that's when we saw the rise in cases. So there's a direct correlation between the two. I'm going to have Dr. Kravik talk right now. Thanks, Doc.
Thank you, Mary Franklin. I guess as we think through where we've been over the last 18 months, and we're now in September of 2021, all I can think of is we have a tool at our disposal. This is not September of 2020. This is not April of 2020. We have the way out. I remember about a year ago, I was actually at Halloween trick-or-treating in my neighborhood, and one of my neighbors said, what's the end game? When are we going to finish this? And I said, soon. I think it's going to come soon. It's going to come with a vaccine. So we have the tool at our disposal now to get us through this. And that tool is the vaccine. We're about halfway there in our overall population. The vaccine is safe and effective. 80% of the COVID patients who are in our hospitals locally, who are COVID positive, are unvaccinated. So yes, there are some who are vaccinated with breakthrough cases. Those tend to be much more mild. Almost all of those in the intensive care unit are unvaccinated. Almost all, if not all of those on ventilators with COVID in the intensive care unit are unvaccinated. So if you get COVID with the vaccine, it's going to be a mild case for the most part. So that is the biggest message. It's inconvenience to be in quarantine and to be in the isolation for the 10 to 14 days that we have to deal with. And the vaccine is your ticket to not have to do that. Besides being safe, it lets you have some semblance of normalcy for a while. So I think that's my biggest message that I continue to say, and I think I can't stress the importance of that enough. As Dr. Shina has said, hospitals are safe. Hospitals are clean. You need to get your routine care, and we want to have room for you in there. And so, as you think about where to go for your mild care of COVID and other respiratory illnesses, there's walk-in cares. There's your primary care office. There's urgent cares around our community. Mercy has set up 8 walk-in sites: Sebring, Austintown, Youngstown, North Lima, Columbiana, Salem, and then here in Trumbull County at Howland and in Liberty. And those walk-in sites are really meant for you to come in and you can get tested there, you can get seen for your symptoms for mild cases. If you need to be in the emergency room with severe chest pain, shortness of breath, very high fever, fatigue, very severe change of mental status, that's for the emergency room, because the emergency room also is for patients with other serious illnesses, non-COVID related. So we want to make sure that we have capacity across our whole continuum from the primary care office to walk-in care to the emergency room. So again, I think as we think through the most important messages we have to continue to talk about is those with the vaccine already, if they do get COVID, it's going to be a much mild case. And when you do need care, call your primary care doctor or seek care to walk-in care. Thank you.
Thank you, Dr. Kravitz. We'll be available for questions after. I'm going to ask Frank Migliozzi from the Trimble County Health District, and then John, you can follow. John May.
Good afternoon. Trumbull County is experiencing a rapid and steady increase in COVID-19 cases and hospitalizations, most likely a result of the Delta variant. For example, the time period of May the 24th through July the 25th, Trumbull County had 286 cases with no reported hospitalizations at the time we interviewed sick individuals. Around that time, around July the 25th, is when the Delta variant became most prevalent in Ohio. Then, from over the last 2 months, from July the 26th through September 22nd, yesterday, we had 3,088 cases with 36 individuals hospitalized at the time we interviewed them. This surge in cases is impacting our schools, our workplaces, as well as our families. It's resulting in high absenteeism, workforce shortages, and entire household members becoming ill. We are also seeing the age of our cases and hospitalizations dropping to those under the age of 50, where the vaccination rates are much lower. Today, the average age of a person in Trumbull County with COVID is 37.5 years old. As for the vaccination status in our county, the highest rate of vaccinations are those 65 years and older. We have reached the 80% mark with those individuals, with the lowest vaccination rate, the individuals between the ages of 12 through 17 at 33%. Overall, when you look at the eligible individuals in our county, we sit at 59.1% vaccinated. Taking a deeper dive into that, those age 50 and older are at 63.7% vaccinated, but those under the age of 50 are at 36.3% vaccinated. The truth is that most of this is preventable through vaccinations, as a vast majority of our cases and hospitalizations are those individuals who are unvaccinated. With the facts that are being presented here today, I'm strongly recommending that you protect yourself and your loved ones by getting vaccinated. We offer, on a weekly basis, vaccine clinics at the Eastwood Mall every Tuesday and Thursday from 5 to 7 p.m. And additionally, we offer some on Saturdays. And this coming up Saturday, we are holding a clinic at 1 o'clock. And then moving forward in the month of October, the 9th and the 23rd, we will be holding clinics there from 10 a.m. through 12 p.m. We're also strongly suggesting that you practice all the other safety protocols of masking, social distancing, and hand hygiene to reduce your risk of contracting the virus and spreading it to others. Thank you.
Good afternoon. I'm the Warren City Deputy Health Commissioner, John May, and I'll briefly just touch on what we're seeing here in the city of Warren. As Commissioner Frank Migliozzi already indicated, Trumbull County abroad and Warren City numbers are within that. But as far as what we've seen for cases starting August of this year, 2021, we've experienced 175 cases in the month of August alone. Of that 175 cases, 139 were of unvaccinated persons, 16 resulted in hospitalization, 4 in ICU, and 3 deaths. Of that number, there were only 7 breakthrough cases. As the doctors have already indicated, there are occasions where fully vaccinated persons will contract the virus. However, it's not a severe case. For the month of September, from September 1 to today's date, The epidemiologist has provided, we have taken on 455 COVID cases. 411 are non-vaccinated individuals. Those are staggering numbers just for the month of September alone. Of that figure that I gave you, 36 results in hospitalizations, ICU, 4, and a total of 4 deaths for the month of September. That's for Warren City, where we're at a population of about 38,000. And 8 breakthrough cases for the month of September. School cases, juvenile cases account for 31.2% of our September cases. And those are children from the age of 1 to 18. The Delta variant has been sequenced in the city of Warren's jurisdiction. Undoubtedly, it's the variant that has caused the spike in COVID-19 and hospitalizations, especially amongst those of a younger age and demographic. Currently, that is the prominent variant in the city's jurisdiction to date. There has been no indication of a newly publicized mutation or variant, and it is imperative during this surge that we mask up, social distance, and encourage vaccination. Only by utilizing these infectious preventions and measures do we have a chance in deterring further spread. Another addition to combat the spread of COVID, Warren City is still offering COVID vaccine. We are now partnered with a local barbershop here in the city by the name of the Downtown Grooming Lounge. We are offering Shots at the Shop, which is a national initiative to reach minorities and disadvantaged persons. And those clinics are held from the hours of 10 a.m. to 1 p.m. And the next upcoming dates is September 30th, October 14th, and October 21st. Thank you.
Thank you, Mr. May. Just in closing, I want to thank Dr. Shiner, Dr. Kravitz, also Mr. Migliozzi and John May from the Warren City Health Department. I consider these agencies and these representatives of those different departments and agencies to be first responders in this fight. And they've been critical to my understanding and how we manage our own crisis here locally. I want to just say in closing, we're all in this together, and I wanted to share with the public. That's why I'm so appreciative of you showing up as the local media to share what I hear every month, or excuse me, every Monday of every week. These numbers are going in the wrong direction. We're all in this together, and we need the public's help. This is a critical crisis that we're facing. We can't do it alone. So I'm asking everyone to get your family members vaccinated. Take care of yourselves, socially distance, and do all the protocols that are recommended here today. Having said that, I'll entertain questions if you all have any. Yes.
This would probably be for Dr. Shiner.
Okay, you guys can stand up now, as long as we can keep our distance.
So I have a few questions about hospital capacity. I'm not sure how much you guys could answer this. What's the concern with hospital capacity? I know you guys were saying, if it's a mild case, go somewhere else to free up some room for hospitals. Are we anywhere close to canceling elective procedures, having to ration care? Is there a concern with hospital capacity now?
I mean, speaking from the Mercy Health side, I'll defer Dr. Shina to the Trumbull side. This is something we look at every day, every hour, whether or not how full emergency rooms are, how full the hospital is. It's very challenging when we see numbers on a snapshot in time, because that truly is just a snapshot in time. The hospitals are very fluid in the sense of patients can be cared for in other areas, such as longer times in emergency rooms and whatnot. However, it's something we do worry about. We do keep our eye on very, very closely to make sure that we can care for the next patient that comes in the room through the ambulance or through the car. So I think we're status quo as far as continuing to care for patients, continuing elective cases, continuing to care for people in the office setting. But it's something we do keep a close eye on. When you think about, patients that stay in the emergency room for a longer period of time because there's no room upstairs in the hospital, what that does is it makes it longer for people to come in then to be seen in the emergency room. So it really is it's a clog in the system. So we just continue to do our best to move patients as we can to allow more patients to come in.
Right, I agree. The biggest issue for us is to not to overwhelm the emergency rooms with things that aren't emergencies. We want people that are emergently ill to be able to be seen there and be seen in a proper amount of time. Again, we're not looking at canceling elective surgeries or anything like that, but there are other there. As opposed to last year when people were scared to go to the hospital, now people, folks that need that kind of care aren't, that scared anymore. So not only do we have the COVID patients we're taking care of, but now we're seeing our heart attacks, our strokes, our, emphysema exacerbations, and so on and so forth. And we want those people to be taken care of too, because again, the hospitals are safe. So yeah, not overwhelming the emergency room, getting patients moved to where they're supposed to be in a proper period of time is a heavy focus. So, it starts in that front door with the emergency room. And, again, agree with what Dr. Kravik says. It's very fluid. It's tough to give you what kind of numbers there are, but that changes by the hour. That's the focus.
I just wanted to ask you one question. The reaction to the governor has a new incentive plan for younger folks. Well, what's your thoughts on that?
Yeah, anything to get the younger folks vaccinated, I'm okay with. I gave a lecture to. I've been the medical director for Youngstown State Athletics for 16 years now. And I gave a lecture to the athletes, to some of the fall athletes back in June about vaccination, just giving them an objective overview of what that looks like. And it's right when the Delta variant was starting to pop up around this way. And the incentivization for me to them was, I want to come watch football. I want to come watch football, possibly without a mask. I want everybody to be healthy. More importantly, I don't want any of you guys to get sick and any of you gals to get sick. So any incentive we can use, whether it's you're not going to have to mask up in school. Yes, you get to play sports you get to play football games on Friday night. Yeah, you can win some kind of lottery, win some kind of prizes. I'm all for it because the younger folks are the ones that are getting hammered right now.
Thank you.
Same page.
Thank you all. Anybody want to add anything, feel free. We left anything out, but this is so important. Thank you all for coming.
Thank you.
Thank you.